Good evening, I'm Alan Unell, and this series of videos is Healthcare Advocacy, where we address problems in the healthcare system and then take actions to try and make a better system for all of us. We're going to be talking about religious hospitals again today and hypertension. Oh, two things that go together. However, before we get to those, down below in the YouTube description box, you'll find a link to the Healthcare Advocacy newsletter. You can subscribe for free. It is the text for today's video. It has all the background material, all the reference material, all the links to the medical journals. Everything I mentioned is in there, as well as lots of useful references. If you need to find an abortion, if you need to figure out how to handle a denied medical claim, if you want to get in touch with healthcare advocacy groups like National Nurses United or Physicians for a National Health Plan, all that's in there. Let's get started. First, let's talk about hypertension, because this is sort of an oddball study that a doctor decided to do for fun, and it turns out to be valuable. Hypertension is the leading cause of cardiovascular disease and preventable mortality worldwide. Accurate blood pressure measurement is the cornerstone of hypertension diagnosis and management. So if you kind of measure it all the time, you're likely to take better care of it. Anyway, the latest clinical practice guidelines emphasize several key steps for accurate measurement, and they include appropriate cuff size selection, for the size of the arm. Make sure that the person is sitting with a back support. Here, I'll sit back so you can see that. Feet should be flat on the floor. Don't cross your legs. And you should have an appropriate arm position. That is, the mid-cuff, where the blood pressure cuff is, it should be just about where your heart is, just about level with the heart. And it's good that if you rest the arm on a desk or a table. So, despite these recommendations, proper arm position is commonly overlooked in daily practice. For example, in the US, blood pressure is often measured with patients seated on an exam table without any arm support or with inadequate arm support, like resting their arm in their lap, or supported by a healthcare professional. Here, I'll hold your arm while you're sitting on the table. Now, this happens when you have a resource-limited setting, sometimes like in the emergency room or an urgent care place. Anyway, the results were kind of significant. The systolic blood pressure, that is the larger of the two numbers, was 4 points higher when measured with the arm in your lap compared to resting on a desk like you're supposed to, near the heart, and it was 7 points higher if your arm was dangling at your side. This is reported in the Journal of the American Medical Association, and I have a link to the doctor's article there. I'm going to give you the date. Today is October 8th, 2024, and yesterday the Supreme Court decided not to hear a case. And effectively what the Supreme Court said to women in the United States was, are you ready? Drop dead. The U.S. Supreme Court declined on Monday to hear a bid by the United States government to enforce in Texas federal guidance requiring hospitals to perform emergency abortions if needed to stabilize a patient's emergency medical condition. The justices turned away the Justice Department appeal of a lower court's decision that actually halted enforcement of the guidance in Texas when a Republican-backed near total ban on abortion is in effect, and against members of two anti-abortion medical associations. So they just turned them away, said we're not going to hear the case. The federal ruling that was in Texas can stand, and too bad for you. The guidance reminded healthcare providers across the country of their obligations. This was the guidance that the federal government gave that was turned down by the judge in Texas. The guidance reminded healthcare providers across the country of their obligations under a 1986 federal law called the Emergency Medical Treatment and Labor Act, EMTALA, that ensures that if you participate in Medicare and you offer emergency care, then you have to stabilize a patient regardless of their ability to pay. Of course, Medicare is the government health program for the elderly, and hospitals that violate EMTALA run the risk of losing Medicare funding. What they decided by not taking the case was that this doesn't violate it. Anyway, effectively, the Supreme Court guidance, or lack of guidance, just tells women, drop dead, and it has another chilling effect. What it says is that the state law in Texas that bans abortion has supremacy over the federal law requiring care in an emergency situation. Here's why it's so important. Excuse me. Not only do 21 states effectively ban abortion, but they conflate abortion with miscarriage management and are willing to allow a woman to be critical before acting to save her life. We have already seen in the last few days a woman in Georgia who they allowed to die. They waited 20 hours before acting on her case and performing critically urgent surgery that could have been avoided, and she did not survive the surgery, making, of course, her children orphans. Charming. But there's more. It turns out that in large parts of the U.S., even where abortion is legal, if the ambulance happens to take you to a religious hospital, you are out of luck. They will let you get as close to possible as death, as close as possible to death before acting, or they send you away elsewhere. As we saw in yesterday's article about a woman in California who was turned away with a bucket and a bunch of towels, and they just said, good luck. States have laws that allow them to deny care for moral and ethical reasons without consequences. These laws are called shield laws. They protect these hospitals from being sued for this bad behavior of essentially letting people die because they don't feel morally obligated to treat them. Nationally, about 800,000 people have only a Catholic hospital or Catholic-affiliated birth hospital within an hour's drive, according to a Kaiser Family Foundation news analysis. That's true for about 10% of North Dakotans. In South Dakota, it's true for about 5% of them. When care is more than an hour away, I think you've heard me mention this before, academic researchers have determined that what you have is a hospital desert, and pregnant people who must travel farther to a delivery facility are at high risk of harm to themselves and their fetuses. It's usually, if you have to go more than 40 minutes, you're in trouble. Many Americans don't have a choice. Non-Catholic hospitals are often too far away to be reached in an emergency, or they're not in the insurance network. Too bad for you. Ambulances, if you're in a serious situation and the ambulance comes to get you, they'll take you to whatever is closest. And if it's a Catholic hospital, good luck to you. Patients often don't know that hospitals are even affiliated with the Catholic Church because often Catholic hospitals buy secular hospitals and just fold them in. You also don't know that if you happen to wind up in a Catholic-owned hospital, they restrict reproductive care, as well as other kinds of care, which we'll talk about later. I included a chart in the newsletter that you might want to look at. What it lists is, I'm going to briefly describe it to you. What it lists is states that have shield laws and abortion bans, states that just have shield laws, and states that have neither. And I counted. I sat there with my little finger and counted how many states have abortion legal and don't have a shield law protecting the hospital. And the answer was 7. That's it. So this is a dire situation all over the country. It needs to be corrected. And this is a politically induced and manufactured crisis on women's health care. You have a number of things we're going to do. I'm going to give you an action in a minute, but the number one thing I want you to take away is make sure you vote accordingly, up and down the ballot. this November. Because if people support this kind of behavior, you got to vote them out. Okay, here's the action to take. Use ResistBot on your cell phone. You can send a text message to 50409. It is sign, S-I-G-N, space, PQYYVJ. Excuse me, sign, PQYYVJ on your cell phone. Here's the message you're going to send. I'll just read it to you. It's not a happy message, as you would imagine. I am your constituent, and I am livid that the U.S. Supreme Court has decided that the federal EMTA-LA Emergency Medical and Treatment Act does not apply to pregnant persons when they show up in crisis at a hospital in Texas. Of course, since it's in Texas, it's everywhere that way. We have 3 problems here, and I want you to get in gear and get them fixed. The first is that women are not full citizens with bodily autonomy in 21 states where abortion is banned. So you need to pass the Women's Health Protection Act and get it legalized everywhere. Second, the U.S. Supreme Court has refused to enforce the Emergency Medical Treatment and Labor Act in Texas with respect to pregnant persons in crisis, essentially allowing hospitals in that state to tell pregnant women in crisis to be ready to die and that they will think about care, maybe, if at all. Third, we have a problem that religious hospitals are refusing to treat pregnant women who present in crisis, even in states where abortion is legal. It doesn't go well for them. Sepsis and the risk of death are very real for them. And a woman with an unviable pregnancy in California was just turned away with a hemorrhage. This is disgusting, as big as an apple. That was how big the clot was. And she was given towels and a bucket and said, go away. And they're not liable. Anyway, I mention this because states have shield laws that block those hospitals from lawsuits if they don't want to perform treatment that they view as objectionable. Now, I want you to craft and support legislation that makes EMTA-LA superior to any state law. The federal law is supposed to have supremacy. Figure out how to do that. And then include shield laws that protect these hospitals and damage pregnant people. Look, you need to do 2 things there. You need to make sure EMTA-LA has supremacy, and then make sure that the shield laws are struck down at the federal level. That's what you need to do. They can't get away with this. Lives are at stake and at risk every day that you don't act. I'm going to be watching for your response and for your public statements on this, and I promise you I will vote accordingly. Okay, that's what I've got for you. Is your blood pressure up? I know mine is. Down below, you can like, share, and subscribe. You can send me comments at healthcareadvocacy1@gmail.com. I will research topics that you find interesting. Talk to you later.